Whether you're exposed at home or in public, contact tracing is a vital next step after a positive coronavirus test. 10 on your sides, Marielena Balouris is in the newsroom now with an update from the Virginia Department of Health. Marielena?
Yeah, Stephanie, Dr. Norman Oliver, who is the state health commissioner, says contact tracing is valuable, even though there are some delays in the turnaround time. He also shared information on the new app the state is launching to help. Coronavirus cases in Hampton Roads are rising. Dr. Norman Oliver, who is the state health commissioner, says those cases are shifting to a younger demographic, the 20 to 29 age group.
Social events and gatherings where social distancing is not practiced and masks are not being worn are a factor in this disease spread.
That's why the Department of Health continues to contact trace. They now have more than 1,500 contact tracers and case investigators across the state. VDH is also developing regional surge teams that can deploy as necessary whenever cases spike.
Having this backup will aid us in providing the additional support that our local health districts will need in keeping up with the increasing cases.
The state plans to roll out a new app called COVID-Wise in early August to help with contact tracing.
COVID-Wise will notify users who have been in close proximity to other users who test positive for COVID-19, advising them that they may have been exposed to the disease.
Dr. Oliver says it relies on people's participation. The information you share is up to you.
There's no location data or personal information that's ever collected, stored, or transmitted to VDH as part of the app.
He also says the state has been testing more than 16,000 people per day for the last week or so. Contact tracers have been in touch with 74% of those cases, something they will continue to do as testing continues across Virginia.
Virginia will continue to have a high rate of testing. We have, as of today, done a total number of tests that is 1,175,814 PCR tests.
Dr. Oliver also said the antibody tests are showing that about 2.4% of adults are testing positive for antibodies, which is what he expects. I'll have more on his thoughts on a second wave of the virus that's coming up in an hour. In the newsroom, I'm Marielena Balouris, 10 on your side.